Let's start off by taking a look at the current coronavirus figures in Australia as they stand now. The number of confirmed cases in Australia is sitting now at 5,552, with the death toll rising to 30. The total number of cases in Victoria stands at 1,115, with a woman in her 70s passing away from Covid-19 in the state yesterday. The man in his 80s from the ACT also died yesterday after contracting the virus. New South Wales, of course, remains the state with the highest number of cases. That state now has a total of 2,493.
Now, a huge operation in Sydney to restock and refuel 5 cruise ships has concluded. Let's now go to Kathleen Ferguson, who's in Sydney for us. We know that there's been a lot of activity on the harbour overnight. Have all those ships now left?
That's right. So 5 ships have left. The Spectrum of the Seas left yesterday, and so did the Radiance of the Seas. And then we've had the other ships leave today, either going to Bali or Singapore. But one ship that hasn't left yet, and we're not sure if it will, is behind us at the moment, and that's the Ruby Princess.
As you say there, it's still there. Do we know what is its fate? What are the plans for the Ruby Princess?
It's unclear at the moment. What we do know is that there are more than 1,000 crew members on board this ship, and it seems to just be doing figure eights up and down the New South Wales coast at the moment. It has said that it needs to stay close to Australia to get medical help, and we do know that several crew members have been medically evacuated to get treatment here. But it is at the centre of a police inquiry now as to why those 2,700 passengers were allowed to disembark in Sydney in mid-March. But as we know, more revelations have shown that the New South Wales Health Department gave the ship the all clear to let those people go, even though more than 100 had acute respiratory problems. So I think the story of the Ruby Princess is far from over at this point.
Has there been a follow-up as to whether people who've been told to self-isolate are actually following those instructions and staying at home?
I'm not sure about people who have been told to self-isolate necessarily, but we're at Harbord at the moment, and we've not far from Manly actually, and we've just heard an announcement at the beach over the comms there, over the PA, saying just everybody, please remember social distancing, stay at least 1.5 metres away from each other. It's really quite busy, and I know a lot of people have talked about concerns about coming out of coronavirus self-isolation with maybe a few more kilos than they'd like, but I don't think that's going to happen in this part of Sydney. Everybody seems to be out and about exercising today, and a lot of puppies around as well. So it seems quite busy down here at the moment.
Well, you can't really blame them, Kathleen, because from where it looks like a beautiful day right there at the moment. So I suppose a lot of people are out there trying to take advantage of the sun, the sea, the surf as well. The case, though, is that New South Wales still remains the highest on the list in terms of infected cases. Just take us through the numbers.
That's right. So we do have that 2,493 cases. As you say, it is the highest number. The latest figures we have on an increase, there was an increase of 104 people on Friday. Now the previous day was 91, and we do know that New South Wales Health is going to test about 110 people that are self-isolating in Sydney hotels at the moment that have come back from overseas. So we can probably expect that number will grow again today when we get the latest figures.
Kathleen Ferguson reporting for us in Sydney. Thank you.
Now, Australians are being warned to be wary of faulty coronavirus home testing kits. Hundreds of faulty kits have been found in air cargo arriving from China and Hong Kong over the past few weeks. For more on this, our political reporter Noor Hayder joins us now from Parliament House in Canberra. Noor, good morning to you. We know how crucial the tests are for Covid-19. What do we know about these faulty self-testing kits?
Well, we're told that Australian Border Force officers have intercepted a number of faulty at-home testing kits in air cargo in recent weeks. 200 units arrived in Perth from China on the 16th of March. The following week, another 2 consignments were detected in Perth and in Melbourne, and they had arrived from Hong Kong. Now, the Home Affairs Minister, Peter Dutton, has warned people that these testing kits pose a public health risk and undermine the work of health professionals. He says inaccurate results could give people a false sense of security and could dissuade them from self-isolating when they should be. Now, the ABC has previously reported that rapid self-testing kits were being advertised on social media, including Chinese social media platform WeChat. These testing kits are not approved by the Therapeutic Goods Administration, and the Home Affairs Minister says that Australian Border Force officers are on alert for unauthorised products.
So, Noel, what type of testing is approved in Australia?
Well, we know that there is only a finite amount of testing kits available in Australia. The federal government has been working on importing more tests, but also working with labs domestically to develop alternative testing methods. At the moment, the only approved tests in Australia are those lab-based tests, but also the point-of-care tests that are being used in hospitals and in clinics. Now, the standard testing method is that nose or throat swab that we've seen pictures of in the past few weeks, and the Health Minister Greg Hunt last week said that the federal government was also working to roll out a finger prick test to GPs. But the warning is to people to be very wary of these at-home testing kits, and they are not approved by the TGA.
Noor Hayder in Canberra there in Parliament House. Thanks for the update.
Hundreds of Australians remain stranded overseas as international travel restrictions become increasingly stringent. More than 200 people are stranded in Cambodia, which is set to declare a state of emergency. Meanwhile, 20 Australians are on their way home from Austria after the federal government reached an agreement with local authorities. The government is still in discussions with airlines to arrange for the repatriation of Australians from London, Los Angeles, Hong Kong and Auckland.
The global death toll from the virus has now surpassed 60,000. According to figures from Johns Hopkins University, Italy has recorded the most deaths with nearly 15,000, followed by Spain with nearly 12,000. Global cases are now above 1.2 million. The US has by far the most amount of cases with more than 300,000. More than 245,000 people have now recovered from Covid-19 around the world.
More than 8,000 people have died from COVID-19 in the United States, with about half the deaths in New York State alone. Officials there are predicting that cases will start to peak within the next week. North America correspondent James Glenday has more.
The state is getting an extra 85,000 medical volunteers. About 20,000 of those are coming from out of state to help. China has announced it's going to send 1,000 ventilators to New York, and Oregon is going to send 130 as well. But the state's governor, Andrew Cuomo, today again said that he didn't have the resources he needed, and he warned that the peak was going to be reached sometime in the next 7 days, he thought. And he was very, very worried that hospitals would be overwhelmed. He'd spoken with the President, Donald Trump, and we actually heard from the Commander-in-Chief himself at a press briefing here in Washington. He said that he was going to give New York all the help that he could. And he also announced that he'd be sending soldiers to the state and other hotspots around the country to help manage things. Here's a little of what Donald Trump had to say.
We're going to be adding a tremendous amount of military to help supplement the states. Thousands of soldiers, thousands of medical workers, professionals, nurses, doctors. They're going into war. They're going into a battle that they've never really trained for. Nobody's trained for this. Nobody's seen this, I would say, since 1917.
That's President Trump there assuring that he is trying to do the best that he can in terms of helping the citizens of the United States. James, there was something I found really interesting Andrew Cuomo had said yesterday, was that you need to help New York now because this is a wave and the wave will sweep through the country. We've spoken about New York being the epicenter. What are the other hotspots in America now?
Yeah, I think that's a really important point because New York is the epicenter and it also has the most recorded cases because people there are testing for it really intensely. And so there's only about 4,000 people in New York, 4,500 in intensive care at the moment. So the other hotspots that are emerging are New Jersey. Now, that shouldn't be a surprise because it's literally just part of the same problem. It's just across the border. There are about 30,000 there. But other states, for example, California, Florida, Massachusetts, Illinois, they all have more than 10,000 cases each. And governors in those states are really, really worried that they could be at a tipping point where they can either clamp down on the spread of the virus or they could see it soar to the kind of levels that we've seen in New York. And they are all calling for help as well because they want to get ahead of this as much as possible. The idea that's been floated out of New York is this idea that there'd be sort of a national register of doctors and nurses and vital equipment that could be deployed really, really quickly across state and local county lines so that bureaucracy doesn't get in the way of saving people's lives. And the president actually said he thought that was quite a good idea and he'd hope that all the different states would be working together as much as possible as opposed to hoarding any vital equipment for themselves.
James, I want to move away from the United States for just a while now. I want to focus on another part of the world, Uruguay, and there's been some more bad news there for a boatload of nearly 100 Australians on board an Antarctic ship there.
Yeah, so this is the Greg Mortimer cruise ship. It left port, the southern tip of Argentina, in the middle of March for a cruise to the Antarctic, and then it turned around about halfway through because a couple of passengers on board developed flu-like symptoms. Now, all the passengers on this boat have been in lockdown effectively since the 22nd of March. And there are fears of a coronavirus cluster on board. 4 days ago, a 69-year-old man was evacuated off the ship, an Australian man. He was diagnosed with Covid-19. In the past 24 hours, 2 more Australians have been taken off, one just in the past couple of hours. And although they haven't been officially diagnosed, they were deemed to be in a fairly critical condition and they have all the symptoms of the coronavirus. On board, most of the other passengers seem fairly healthy, but the couple that I have spoken to have continually said that things that seem to be getting more dire by the day, and they're really, really hoping for any news at all that they might be able to get off and get on some sort of charter flight back to Sydney as soon as possible because they're worried that if the virus is on board that it could continue to spread cabin to cabin to cabin. And a lot of the passengers on board are relatively elderly. I think the average age is the mid-60s or so. So that is certainly a fairly concerning situation for about 96, somewhere between 90 and 100 Australians on board that ship.